The Epilepsy Foundation is pleased to share with you an educational webinar, Epilepsy and College, Strategies for Success. The mission of the Epilepsy Foundation is to lead the fight to overcome the challenges of living with epilepsy and to accelerate therapies to stop seizures, find cures, and save lives. My name is Dr. Elaine Kyriakopoulos, and I would like to extend a warm welcome to everyone who has joined us this evening. It is wonderful to have you with us for tonight's learning. The Epilepsy Foundation is working to provide information and education that serves the spectrum of individuals and families impacted by epilepsy. It is common when you have a question about your health or your loved one's health, you may hear or read things you're not sure how to interpret. The Foundation's webinar education series aims to bring together expert clinicians, scientists, and advocates who can share with you the most up-to-date and accurate information to help answer your questions. I'd like to review with you the format for tonight's webinar. Throughout the presentation, all phone lines will be muted. However, we would like to encourage everyone to submit their questions at any time during the webinar. To do so, type your questions into the question window on the GoToWebinar panel and click Send. We will read your questions aloud and address them during the question and answer portion of the webinar. Please keep your questions general in nature as the webinar is intended for educational purposes. This webinar does not take the place of individual medical or legal advice. The webinar will be recorded and available for viewing and listening on epilepsy.com. The transition to college is a major milestone for teens and families. The college journey allows a teen to gain new social independence, learning opportunities, and personal responsibilities. For some parents, adjusting to this time of change, separation, and transition can be difficult. Along with the outward signs of change, there are many changes taking place in the brain of a person who is in their late teens and 20s. Within the human brain, there are approximately 100 billion cells, nerve cells, called neurons. Each neuron is connected to roughly 10,000 other neurons. It's fair to say that sitting on our shoulders is the most complex object in the known universe. It is estimated that there are more than 100 trillion connections in the human brain. In the first few years of life, over 1 million new neural connections are formed each second. An advanced MRI technique called diffusion tensor imaging, which makes these pictures you see here, makes it possible to estimate both the location and orientation of brain pathways. Sophisticated imaging techniques like this allow for neuroscientists and clinicians to study the dynamic nature of the brain's pathways as a person matures through different phases of life. What separates teens from adults is the strength of these connections, both structural and functional, between parts of the brain that make integrated activity efficient and reliable. After the period of infancy, the brain's most dramatic growth phase occurs in adolescence. The brain is really a dynamic organ for a lifetime, and the maturation process that comes with the phase of young adulthood extends well into the 30s. We are so fortunate to have with us tonight two wonderful guest speakers who are going to share their expertise and advice on how to approach and navigate this dramatic and dynamic time of change in the lives of teens and families. It's a wonderful honor to introduce you to our guest speakers tonight. The first is Dr. Kate Nichols. Dr. Nichols is certified in neurology with special qualifications in child neurology, clinical neurophysiology, and epilepsy. She is an associate professor of neurology at the Mayo Clinic. She has expertise in pediatric epilepsy and analysis of clinical EEG, both scalp and intracranial recordings. She has expertise in treating pediatric epilepsy through pharmacologic, dietary, and surgical methods. Her research experience includes multiple epidemiology studies using the Rochester Epidemiology Project regarding diagnosis, treatment, and outcome of pediatric epilepsy. Furthermore, she teaches maturational changes in EEG as the EEG course coordinator for both the neurology residents and fellows, and also for the clinical neurophysiology tech program. In that role, she has received the Outstanding Physician Scientist Educator Award and is an associate in the Academy of Educational Excellence at the Mayo Clinic. She collaborates with pediatric epilepsy specialists throughout the country through the Pediatric Epilepsy Research Consortium to determine best practices and treatments for early onset pediatric epilepsy encephalopathies, with particular attention to infantile spasms and myoclonic atonic epilepsy. She is also an active volunteer for the Epilepsy Foundation of Minnesota, serving on the Professional Advisory Board and the Regional Advisory Council. The National Epilepsy Foundation is also very fortunate and appreciative of Dr. Nichols' time, as she is a member of our editorial board at epilepsy.com. Welcome, Dr. Nichols. I am also thrilled to be able to share the expertise of Allison Nichol with all of you this evening. A little bit about Allison. Prior to joining the Epilepsy Foundation of America in November of 2018 as the Director of Legal Advocacy at the Jean A. Carpenter Legal Defense Fund, Allison Nichol had the privilege of serving the Department of Justice for more than 20 years as both Deputy Chief and then Chief of the Disability Rights Section of the Civil Rights Division, which enforces the Americans with Disabilities Act, and then as Special Counsel on Disability Employment to the Deputy Associate Attorney General for Diversity and Inclusion, Office of the Associate Attorney General, in which capacity she also served as a member of the executive staff of the Attorney General's Diversity Management Advisory Council and liaison to the Attorney General's Committee on the Employment of Persons with Disabilities. During her tenure, she served as the department's longtime expert on HIV law and policy, overseeing all HIV litigation and representing the department on the Federal Working Group on the National Strategy on HIV/AIDS and the Federal Working Group on the intersection of HIV/AIDS, violence against women and girls, and gender-related health disparities. She wrote the division's policy guidance, United States Department of Justice Civil Rights Division Best Practices Guide to Reform HIV-Specific Criminal Laws to Align with Scientifically Supported Factors, and co-authored Prevalence and Public Health Implications of State Laws that Criminalize Potential HIV Exposure in the United States, AIDS and Behavior, March 2014. Allison, thank you so much for being here with us this evening.
Thank you.
There are no disclosures for this evening's presentation, and at this time, I am going to turn the webinar over to Dr. Nichols.
Thank you so much for allowing me to join you this evening. This evening, we're going to be talking about important information needed for families and students as they plan to attend university. I will be discussing the concept of growing independence and preparation that needs to happen before going to school, some recommendations for choosing the right college, and then also tips and tricks for improving safety while on campus. And then Allison will be discussing the rights of these students. Next slide, please. So let's start talking about this concept of growing independence. Next slide. Keep in mind that children with chronic disease often are monitored and protected by their parents more so than other children. And for epilepsy, this is certainly the case because it's a very unpredictable disease. On the other hand, the more independence we allow children to have early on, the more prepared they will be for college. Now, I have to admit this concept is very near and dear to my heart because my oldest child is leaving for college in 2 weeks. And so we've been working hard to prepare her. So some of the information tonight is not only for children with epilepsy, but really can be applied to any child, and certainly any child that has chronic disease. Next slide, please. So the first thing that I always want my patients to do is to understand that this is their disease. They need to take ownership of it. That means that when patients come to see me in the clinic, I want them to be sitting close to me on the couch and not their parents. I love the concept of you can control it or it can control you, which means that the patients should now do everything they can to take control of their disease and to avoid any triggers if possible. After all, this is their epilepsy, not their parents. I want them to speak up about their needs because as parents and physicians, we can have ideas about what's important to that child, but honestly, we don't know what aspects of their disease are most bothersome to them. So I want those patients to start speaking up with me, and by the time children are in junior high, I really expect them to start providing me with a history of what's been going on with their disease since I last saw them. If they are new to the clinic, I want them to provide the description of what happens during a seizure and how they feel. I want them to speak up at school. Many of these students have education plans such as 504 plans or IEP, and they need to be attending the meetings so they can bring up what is important to them. And then they also need to speak up at home. They need to talk with their parents about their concerns. Next slide, please. So remember, and this is for the students, the earlier they start to show that they are responsible, the more comfortable their parents will be with them moving out of the house. For example, I have 2 children who both have learning disabilities. One, like I said, is going to college in 2 weeks. The other one is starting 9th grade. The younger one decided last year that she was going to be independent for healthcare making, which was obviously anxiety-provoking, allowing a 13-year-old to make these decisions. On the other hand, after watching her being successful at this for the last year, by the time she goes to college in 4 years, I suspect I will not have any concerns. By comparison, the teenager who is a senior in high school and is still receiving medication directly from their parents and doesn't even understand how to call in a refill is not ready to attend school. So we need to start doing this as early as possible. Next slide, please. It's also important that these young adults understand what their epilepsy is. As we all know, there are many different types of seizures. There are many different types of epilepsy. Even seizures that have the same label can be experienced differently from one patient to the next. And so it's important that each student know what type of seizure they have using the specific names such as focal or complex partial. They should be able to describe if they have an aura. They should be able to describe what they remember from seizures, and they also need to be able to tell people what others observe. If there are triggers, they should be able to identify them so that they can avoid them in the future. If there is a specific known cause for their epilepsy, they should know that. They should know what previous evaluation has been done and what the results have been. Next slide, please. They also need to understand how difficult their epilepsy has been to treat. They need to understand if they have a history of status epilepticus, especially if it has required extensive medications to stop the seizures. They need to know what medications have previously been tried, if they were allergic to any of the medications before, or if they didn't tolerate them. They need to know if some were more helpful than others or better tolerated. And I always recommend that students wear some sort of medical alert bracelet. Now they have really nice looking jewelry that also happens to be medical alert identification that comes as bracelets or dog tags or necklaces. They can have more than one, but I do recommend that they wear it at all times. And it's also reasonable that they carry a list of current medications and allergies. Now, I've had some students tell me that they keep all of this information in their phone, but if for some reason they can't unlock their phone, none of this information would be available. So it needs to be somewhere that a stranger could readily find it. Next slide, please. They should also understand what medications they are currently taking, and they should be the specific name. They can be the brand name, they can be the generic, but they need to know the specific name and not just, oh, the little white pill or, oh, the one that has a K on it. Again, if they have any allergies, that needs to be available. If they have any medication side effects, again, at this stage, I want them to be discussing it and I want them to be bringing it up with their physician. They should also know which pharmacy they use and how they get refills. Some pharmacies have an automatic refill system, whereas for others, you need to call in if you need refills, or you might be able to do it online. But they need to know how often it's done, every 30 days or every 90 days, how often they need to contact their physician, how many refills they have left, and then how they would make that contact with the pharmacy. Next slide, please. I often find that families become very anxious when it's time for the young adult to take over taking their medications. Parents like to ask the young adult multiple times per day if they have taken their medications, and then the patient is not interested in being reminded multiple times and usually winds up forgetting, or the parent may remind them, the child says that they will take it, and then they ultimately forget. And so pill boxes are great for different reasons. First of all, they remind our teenagers for when they need to take their medications and if they've taken it. It avoids them taking extra doses too if they've forgotten they've taken it. They can just look, and if the pills are there, they need to take them. If they're not there, they've taken them already. There are even fancier pill boxes that are on a timing system or have alarms. But then the other nice thing for that teenager who wants to be nagged less and have more independence, the parents, rather than asking the teenager if they've taken their medication, can also go look at the pill box. And so as they're increasing their independence, the first thing that I have them do is use the pill box. And then the second step is to fill the pill box on their own or with parental supervision. Next slide, please. I also strongly recommend that they use some sort of a reminder app on their phone or their watch. We all know that teenagers have their phones with them almost all the time. There are multiple reminder apps that can be used, or they can just set a timer. I don't want them to be socially restricted because they're taking medications. And so if their friends are going out in the evening, I want them to go too, but I also don't want them taking their medication late. So it's very helpful if they just take an extra dose with them at all times so that they can just take it and be compliant with medications but still be socially active. And then sooner rather than later, I want them to get into the habit of noticing when they are due for a refill and first telling their parents when they're due for a refill and eventually calling in their own. Next slide, please. Now is when I like to introduce a little detour for the females, because it's important to understand that many of the anti-seizure medications interact with oral contraceptive pills. The majority of those that interact will decrease the efficacy of oral contraceptive pills, regardless of why you're taking them. Oral contraceptive pills will reduce lamotrigine levels by up to 50%. So if you're someone who is stable on lamotrigine and you want to take oral contraceptive pills, you can, but recognize the lamotrigine dose will likely need to be doubled. It's also important to recognize that it's not your neurologist who prescribes oral contraceptive pills, but it is likely your neurologist who recognizes the medication interactions. The primary care physician or OB-GYN who is prescribing the oral contraceptive pills may not be, and in fact is unlikely to be, aware of medication interactions between the seizure medicines and the oral contraceptive pills, so it's always good to double check and ask if there are any interactions. Next slide, please. The reason why I'm so picky about knowing which medications decrease the efficacy of oral contraceptive pills is because unplanned pregnancies are very, very common in women with epilepsy. Up to 80% of pregnancies in women with epilepsy are unplanned and outside of a stable relationship. So what does that mean? It's one thing for a family unit to have multiple children and to have a surprise child. That is an unplanned pregnancy within a stable relationship. That is not the same as the teenager who becomes sexually active, does not have a stable relationship at all, and becomes pregnant. And so when I'm teaching trainees, I always tell them that when they prescribe an anti-seizure medication to a woman of childbearing age or shortly to it, they should plan on that woman becoming pregnant on the medication, it being an unplanned pregnancy, and likely not being aware of the pregnancy, and certainly not contacting the neurologist until several months into the pregnancy. And so it's really, really important that we, number one, have planned pregnancies, recognize that many of the medications can affect a fetus, recognize that many of the medications can affect oral contraceptive pill efficacy. Next slide, please. It's also important to avoid the known triggers, control what you can control, and show responsibility other ways. Be responsible with schoolwork and chores. Take on extracurricular activities. Recognize ways to become independent for transportation, even in people who can't drive. Now we have a number of different rideshare abilities. Take on some responsibility for your clothes shopping. Show your parents essentially that you can survive without them. Next slide, please. Again, it's important to participate in healthcare. Be the one to contact your healthcare team if there are questions or concerns. There's no reason why it has to go through the filter of the parents. Students can be making their own appointments with some guidance. Again, my 13-year-old took on making her own appointments. I provide days and times during which I can provide transportation and attend the appointment, but she calls the phone line and makes the appointments herself. I want the students to be keeping track of their seizures, triggers, side effects, and often a seizure diary is really helpful. Again, this can be electronic or this can be a paper diary. And then from this, put together a list of questions. Again, parents can help come up with that list of questions, but then I want the adolescent to be the one who asks them at the appointments. Next slide, please. When the adolescent comes in to see the provider, again, I want them to talk, not just let the parents do it. Share concerns, feelings, and needs. Discuss any seizure symptoms that might be concerning about, that they might be concerned about. We want to keep these students safe. And most importantly, I want them to know their own bodies and make decisions. Next slide, please. Next, we need to identify lifestyle needs. How do we avoid triggers? It's not just enough to know that sleep deprivation is a trigger. How do we provide ways to make sure that they have sufficient time to get schoolwork done, to do their extracurricular activities, but still get the sleep that they need? This is also going to be important when they choose a campus. Do they perhaps need to avoid a campus known for a very active social life? Some students just do better living at home and then commuting. It's also important for them to take a moment and look at their mental health. Do they have issues with anxiety and depression? Next slide, please. And this is where we talk a little bit about mental health awareness. Again, anxiety and depression are a very, very common comorbidity of epilepsy. So people with epilepsy are really likely to have anxiety and depression regardless of medication, regardless of seizure control, regardless of seizure type. Once they leave the social support of home, if untreated, anxiety and depression are likely to get worse because they've lost that safety net. And so if there's any concern about anxiety or depression, it's important to get that screened before leaving home. And then if present, really important to get treated or to start treatment before leaving home, and then also make a plan for continuing treatment at college. Next slide, please. Next, it's important to choose the right college. Now, this is important for any student. Next slide, please. We need to recognize that there are so many colleges and universities throughout the world, within the U.S. It's important to find the one that suits the student the best. And by finding the one, I mean the one that has the preferred majors, job opportunities, but also looking at the academic class size, the overall school size, the ratio of professor to student, what interactions are expected between the student and counselors. Is it a school that has an assigned counselor with assigned times to meet, or is it a school where it's really left up to the student? Is it a school where tutoring is available? Is it free? Does it need to be arranged ahead of time? We need to think about the social part. Again, if alcohol or staying up late is a real temptation, then maybe a school with a very active social life and active Greek life might not be the best. It's important for students to know their temptations. Next slide, please. We need to think about housing. Not all schools have on-campus housing. Some schools have it, but it's optional. Other schools require obligatory on-campus housing throughout the college career. So you need to look at the one that works best for the student. Once that decision is made, questions might be asked about how far their dorm is to their classes. Is there air conditioning provided? If there is air conditioning provided in only specific dorms, do they need to have air conditioning? Do they need to have a letter of support provided by their physician for that preferred dorm to be available? We need to think about roommates. The roommates can't keep that student up all night long because sleep is a well-known trigger for seizures in just about anyone with epilepsy. We also might want to think about whether or not that roommate should provide seizure safety training. We need to think about public transportation and whether or not that should be available. Also, when students visit campuses, I always recommend that they look at the medical services and also the mental health services. Next slide, please. Choose a school that works well for you and visit them. When they are on their campus tours, I always recommend that they meet with the disabilities office in order to discuss accommodations for academics, housing, transportation, and then also seizure safety. Next slide, please. Also, it's important to decide whether or not your 504 plan will go with you to school. It certainly can. If a student is requiring accommodations, it's much easier to have these documented in high school before they go off to college, and it's important to, for these students to advocate for themselves. Next slide, please. Again, if a student has a 504 plan in high school, it can go with them to college, and that provides them with accommodations such as test-taking services, priority registration, to allow them to not be sleep deprived, have those preferred class times. Accommodations should also be made for missing classes because these students might have seizures, might have multiple appointments. So this is important to work with the disabilities office and have arranged before school starts. Next slide, please. Also, don't forget that there are multiple scholarships available to students with epilepsy. Several of my patients have won these, and it's great. Next slide, please. Okay, so the next step is you know where you're going, but you're not gone yet. Next slide. So now what do? Again, review your medical care, work with your neurologist, work with your parents, know when your next appointment is scheduled and how and where it will be done. Are you going to be changing a neurologist or staying with the local provider? Next slide, please. Again, review medical care. Look around campus. Decide where prescriptions will be refilled. Is this going to be done through mail order or through the local pharmacy? If prescriptions need to be filled quickly, is there a pharmacy close by? What are your copays? How will you pay for them? And do you have a plan in place for missed or lost medications? Next slide, please. Review medical insurance. Always important to know what your insurance will cover. If there are preferred clinics, pharmacies, or hospitals, then you obviously want to use that. Make sure that all the students are carrying insurance cards, and it's a good idea to meet with the health center once you get to school. Next slide, please. Again, meet with the Disabilities and Housing Office once you get to school, even though you've already met with them on your tour. Review the accommodations, discuss a plan for who is going to be responsible for that student during a seizure, where rescue medication will be stored and who can administer it. It's important that campus safety also be aware of these students. And some of the dorms can even receive seizure safe training. Next slide, please. And again, just a reminder about how important it is to have a good seizure action plan even once they go to school. Most of these students have had them in high school. This should go with them to college as well. Next slide, please. Here's an example of a seizure response plan through the Epilepsy Foundation. This can be carried with the student, but student health and security should also have a copy of it. Next slide, please. Now, once they have arrived on campus, we can make some additional changes to keep you safe for campus life. Next slide, please. First of all, make good choices. Often, I will send kids off to school perfectly well controlled, and then they decide to not take their medication, stay up late, and drink alcohol. And this is a recipe for disaster, and everything that's possible should be done to avoid it. Keep in mind that even though your parents have been controlling medications up to this point, deciding not to take medications only hurts the person with epilepsy, as well as their parents. All-nighters are never a good idea. It's not good for learning either way. When going to a party, it's important to remember that there is no such thing as just this once. So if you always tell people that no, you don't drink alcohol because they interact with your medications, or you don't drink alcohol because you just don't drink, if you do it once, then you'll never be able to use that excuse again. People will always say, oh, but you did it that once. So do not drink alcohol at all. And that means taking a covered cup with you to a party so that alcohol can't be poured into the cup. Do not expect non-alcoholic beverages to be provided. Come with a plan, and come with that plan to include not drinking alcohol. Also keep in mind that smoking marijuana is not an anti-seizure treatment. In fact, it can make seizures worse. It is not the same thing as medical cannabis. Next slide, please. Don't forget to eat. Often students get very busy, parents aren't providing meals for them anymore, and they can skip meals, which can then lead to lower seizure thresholds. Remember to schedule breaks. Remember to sleep. Remember to get up and move even when you're studying, and most of all, don't forget your medications. Next slide, please. And be safe. People with epilepsy are also more likely to make impulsive decisions, which can make the student vulnerable. So, like I said, when going to a party, they should always bring their own drink in a covered cup or a bottle. Know how to get rides home. Don't depend on someone who might not be making good choices. And this advice actually comes from my sister to her own teenage children. Always go towards people, lights, and sound. You never want to be isolated and moved away from the group because, again, that makes you vulnerable. So always move towards people, lights, and sound. Keep yourself safe. Know your triggers and do everything you can to avoid them. Next slide, please. Work with campus security. Know where the campus safety alarms are. The vast majority of universities across the U.S. have them. When you get there, notify campus security that you have epilepsy. Describe to them what happens during a seizure. Provide the first aid information. Provide that seizure action plan. Provide a photo of the student so that if they were to have a seizure on campus, campus security would recognize the student and know what's going on. And then you can always ask about getting rides in winter or if it's dark or late at night. Most campus security programs will provide rides home. Next slide, please. We always need to think about this time of forming new friends. Who do you tell about your epilepsy? I would say the resident advisor in the on-campus housing and the dorms would be helpful. Employers, teachers, especially if you are getting accommodations in the classes. And you likely will want to tell your roommate as well. And again, it's important that those who know about the epilepsy receive seizure safety training. And again, remind them that even though seizures can look scary, you've lived through them before and you're going to be okay. Next slide, please. Often, you can post seizure first aid information throughout the dorm, the fridges, public spaces, inside your dorm room. You can hang a stopwatch on the doorknob so that if they come in and see that you're having a seizure, they can time it and know when to call emergency contact. And they should also know, again, who they should call. Next slide, please. Are there risks of uncontrolled seizures? Absolutely. So if the student is having more seizures once they get away from school, I don't want them to wait to their next appointment. I want them to call their epilepsy doctor or the nurse because those risks of uncontrolled seizures are very serious. They increase risk of injury. They increase risk of sudden unexplained death in epilepsy. Next slide, please. Also set expectations and boundaries for the family. Recognize that these parents are frightened and panicking all the time. So we need to set boundaries for when parents are expected to check in and when the student is expected to check in with the parents. Parents don't necessarily need to be calling all the time, but we also want to do our best to alleviate some of their panic. Next slide, please. So in summary, it's important that students know all about their epilepsy, start increasing independence for taking medications, increasing independence for contacting and speaking with their providers. They need to know their needs, know their triggers and limits and avoid them, understand the resources that are available to them once they move away and go to college, and then overall celebrate success. This is a very big deal, and we're thrilled that these students have graduated from high school and are moving on to university. So I want them to enjoy this time. Next slide. And so now I will turn the time over to Allison Nickel to discuss transition and advocacy. Thank you.
Thank you very much, and thank you for all you just taught me, and thank you for the other folks that are on here for coming to be in conversation with us tonight about what is a critical subject for you and your children. I would just want to echo two of the things that Kate said about campus safety. I really do implore you to take the advice of introducing yourself to campus police. I get calls every day, not necessarily involving campus police, but involving other kinds of law enforcement, where there's been an interaction between law enforcement and a person who's having a seizure or who is just post-seizure, and the law enforcement officers don't recognize what's happening and view it as either non-compliance or that the person is on some kind of illegal substance, and it usually has a very, very bad outcome for the person with epilepsy. So I implore you to do that as well. The other is when it comes to drinking, and I don't know anything about the medical side, but I do know a lot about the nefarious side of human behavior, having been a lawyer for a long time. So the other thing that I would encourage you to do is be very careful. Even if you're drinking a Diet Coke, take it with you if you go to the restroom. Never leave a drink on a bar or on the table at a party and come back to it, because you don't know if someone has put something in that drink, even if it's a Diet Coke, that you can't taste or smell that may render you to be intoxicated in a way you're not familiar with and or unconscious. So I just wanted to really echo that. So let's go to the first slide. Next slide, please. So I'm really going to talk about the transition to college, which we've covered a little bit. And I'm going to use just a slightly different language around 504. If you or if you're a student and you have an IEP, or your child has an IEP, that doesn't exist in college anymore. IEPs go away. Formal Section 504 plans also go away, and that can be very disquieting for everybody involved, because you've had these for a long time. Now, the protections of 504, the ability to get reasonable accommodations, of course, remains. Section 504 and the Americans with Disabilities Act are the two primary federal civil rights laws that govern your life in college. A little bit of the Fair Housing Act, depending on what the issue you may be having with the dorm is. And to echo another thing that's already been said, if you think there's going to be difficulty with the rules around dorms in terms of, I want to be in the quietest dorm, or I don't want a roommate, and the policy of the school is you have to have a roommate. We saw this play out recently at a very famous college, Notre Dame, where the student did not want to have a roommate, and Notre Dame absolutely would not relent on that policy. So colleges can really cling to some of these policies for reasons that I can't really understand, but I encourage you to address the housing issues as soon as possible, and maybe even make that part of your college selection process. The other thing I would note is that the other thing it should be, or can be a part of your college selection process, is how good is the college at giving students the kind of accommodations that they need. There are all kinds of listservs. I'm sure your children can find them among disabled students at these colleges, who will tell you whether or not they feel like they're in an environment where people want them to learn and succeed, or whether they have to fight tooth and nail for every kind of accommodation that they're asking for. Next slide, please. So the primary difference, as with everything else we've talked about between high school and college, is that you're becoming, your child is becoming more independent. So the notion that the school personnel are going to gather the experts, precipitate the meetings, discern what's needed, that all goes away in favor of a much more of a self-advocacy mode. So I completely agree at the earliest that kids can learn to self-advocate in some smaller settings. It's good for this transition as well. If your child, the difference, of course, between an IEP and a 504 plan is the 504 is much more general. If all your child needed in high school was medication, they may only have a 504 plan. An IEP is really in circumstances where the manner or type of learning or ability to learn is implicated. And so you may be, depending on which of those you had, you can still get everything that you got as an IEP as an accommodation. It's just in college, it's centered under 504. Professors also can be very independent in colleges in a way that they're not really allowed to be around accommodations in primary and secondary school. And so that's one of the things you need to keep in mind. I highly recommend that you visit and become familiar with people in the 504 regional accommodation office. But also they're going to tell you that there are moments at which professors have a level of independence that even they can't control. Have a situation right now of a person who cannot read documents on a computer for a long period of time, and as you may know, hard books, including textbooks, have gone away now. Everything's electronic. So if you're one of those people because of your epilepsy that needs as an accommodation the pages in the book to actually be printed out for you, you may have some trouble with that. You may have some trouble with that coordinator at that college understanding why you need that. And so the kind of expertise you find at the high school level about understanding accommodations and why they're needed and how they work doesn't necessarily always exist at the college level. And so an assessment of that program before you make a selection is, I think, really important. Next slide. And this is just, again, a recitation of here of the things that we've already talked about. I would disagree a little bit with the notion that you can take your IEP documentation and your 504 documentation with you to college, and that the college will necessarily always accept that. It may be, especially, for instance, if you're talking about in an IEP person with a learning disability that needs extra test time, it might not be uncommon for a college to say we want more recent documentation, and unlike in primary and secondary school, you actually have to pay for that. So that's another thing I think that you want to find out during the college selection process is what kind of documentation are they going to ask for, and are you going to have to go through a whole other round of getting supporting documentation when your child leaves high school and enters college. And again, that, unlike primary and secondary school, as you may know, can be very, very expensive. The documentation in college must provide specific function. What are your specific functional limitations? You may have limitations that a college 504 coordinator is unfamiliar with. And so I think that it's important for you to know that going in and do as much advanced work. It's really do as much advanced work as possible so that it's not the first week of classes that you haven't gotten your accommodations or they're suddenly telling you that there's a problem. Advanced work, right along will lead to a much more smooth transition. Next slide. And here the parents' role changes as well, and I know this is very both exhilarating and disquieting time for parents, especially for parents who have kids with disabilities, including epilepsy. You kind of have to let go and let your child make their own way, and that doesn't mean you don't worry about them or check on them, but they have to learn at some point to self-advocate, because people with epilepsy are going to have to self-advocate at every stage of their life. Once they're done with college, they're going to have to self-advocate to get testing accommodations if they want to go to law school. And in law school, again, they're going to have to self-advocate. And certainly when they get out into the workplace, they will have to do a lot of self-advocating if they need reasonable accommodations in the workplace, because there is a lot it can be a lot of discrimination against people with epilepsy in certain professions. So I really encourage parents to try to hold back as much as possible. Now, if your child ends up having significant problems getting what they need in college, you don't want to wait too long. Right? You don't want to be halfway through the first semester and still the accommodations haven't come, because then your child's lost the opportunity to learn for half a semester. So start early and often, but it's better to prepare your child to make the argument than for that child to have you make it for them, as difficult as I know that is to hear. If you have a child who plays sports, that could be an issue. Overnight trips, that could be an issue. If they want to go study in Europe, that could be an issue. Any kind of participation in anything, even beyond the academic setting, is going to be covered by Pro 504 and the ADA. And I have had cases where young women wanted to crew. They wanted her to wear a life jacket. She didn't want to because it affected her time. So, we had to have a conversation about that. And, basketball, soccer, there are many others, and going on week-long trips. So, unfortunately, your children are going to be in a constant learning process in college, but they're also going to be in a constant process of educating other people about the fact that they get to make their own choices, and that there's a duty on the college's part to accommodate what they need in order for that to happen. Next slide, please. And this is, I think one of the biggest differences actually between high school and college, as I've already said, is that teachers in high school may be told to modify a curriculum as a reasonable accommodation. Professors really are not required to modify the design or alter assignment deadlines necessarily under 504, and so you're going to have to, again, it pays to know in advance whether or not that's going to be available to you. There are people who have made a request, for instance, for one of the core curriculum classes that is very difficult for their child to not be required. 504 doesn't require that. You cannot force a college to waive, for instance, a basic mathematics requirement or foreign language requirement because of the difficulties that your child may have learning in those areas. I think that the other, as I said, the other major difference is, and you may have experienced this already in high school, but the fact that everything is electronic now can be extremely difficult for some folks on whom constant computer use can be difficult. Next slide, please. And I think this is the point at which I turn it back to Elaine. And I know that we'll have questions at the end. And so I look forward to having further conversation with you about this.
Thank you, Dr. Nichols and Allison Nichol, for a comprehensive and practical guide to the transition to college and to being well prepared to face the challenges that epilepsy can sometimes bring during this time. I would like to take a moment to share with everyone with us this evening resources to help you find support as you and your family make your way through college and the college experience. If you have questions about your epilepsy, as you heard from Dr. Nichols, a good place to start is with your doctor or nurse. They are always an important first step. If you have questions about your learning and education, Remember to speak with your student advisor and the disability office on campus. They are meant to be there to support you and to help you maximize your learning and success. If you're interested in learning more about your epilepsy and steps you can take to manage your epilepsy, epilepsy.com can provide you both with learning and also with links to self-management programs that can help you with journaling your seizures and your triggers for seizures. They can help you, these management programs, with sticking to a medication schedule so that you're less likely to miss a dose of medication. Remember, missed medication is the #1 reason that people have breakthrough seizures. So it's really important to follow your doctor's suggestions for how and when to take your medication. Epilepsy.com is also a great link to the Foundation's Wellness Institute. And the Wellness Institute provides resources online that can help you with tips and reminders to ensure that you are sleeping well, eating well, taking care of both your emotional and physical health. For help guiding you to additional supports and resources, you can also call into the Foundation's 24/7 helpline. In addition, the local Epilepsy Foundation office nearest your college campus can help to provide you with resources and support, as well as programs geared towards young adults. They can also help to direct you to an epilepsy center close to your school if needed, where you'll find medical providers who specialize in the diagnosis and treatment of epilepsy. Ideally, as Dr. Nichols reviewed, your plan for care and follow-up with a medical team should be set before you head off to college. However, in the case of an emergency or if the situation presents where you need to find a neurologist close to your school, the local Epilepsy Foundation can help to guide you to epilepsy specialists nearby. Next slide, please. I would like to take this opportunity to again thank our guest speakers, Dr. Kate Nichols and Allison Nickel, for a fantastic evening of learning. I would also like to thank all of you for taking time to join us and for your attention this evening. The Epilepsy Foundation is here to help as best we can, and we encourage you to continue to reach out to the Foundation with your questions. And we also hope that you'll join us again as we continue to provide education and information to help individuals and families navigate their epilepsy journey. I would also like to take a moment to say congratulations to all the students and families who are about to take the next step to college. You've worked hard to get here. Enjoy this exciting time and share your success. Your family, your medical providers, and your friends are all rooting for your success.